I'm Abbey Fueger. I am a nurse at the Leukemia Lymphoma Society. I work in the Clinical Trial Support Center. And the trial that you're speaking about was a registry trial. So the LLS was collected data from patients. It was a voluntary collection of data from patients where they could submit about their lines of treatment for CLL. So we were able to gather a lot of real-world data from that. And with that data, we were able to see with lines of therapy, with ibrutinib and some of the second-class BTK inhibitors, like acalabrutinib, the differences in side effect profiles. And so what we really saw with that was that with that data that people with the first line, ibrutinib, had a lot more cardiotoxicities than people with the second line. It was like a 21 to 5% difference rate. So what does that tell us? It tells us that there's a lot more cardiotoxicity in the front line. So we're making progress in getting less cardiotoxicity. The real world data shows us that it's in real patients. We're looking at what's actually happening in patients. So that's important for what we're doing for our research and for our future research. We're going to be able to use this data to really look for better outcomes for patients. Now, it did show us that there was no actual change in therapy for patients. It didn't alter their treatment course to have these cardiotoxicities, but we do know that they exist and that we're moving in the right direction and we're getting better with the medications for patients with CLL.